So let's talk about discs for a second, because I've had a number of patients tell me that they have disc degeneration in a certain area of their spine, so we might as well leave that area alone. And as a chiropractor, my mind is like, no, discs are my specialty. We're going to look into that and see if we can not only stop the degeneration, but maybe reverse it a little bit. And yeah, as a chiropractor, I'm adjusting one vertebra on another, creating alignment. But you got to think about, what are they misaligned on? They're misaligned on the disc in between the vertebra. And so the disc is made up of connective tissue fibers that go in a circle. And in the middle of that circle is a nucleus, mostly water, that usually should stay right there in the middle and should be kind of the ball bearing that the vertebra is able to have its movement on and give you the movement that your spine should normally have. What ends up happening is those fibers in the annulus get little micro tears in them, whether it's from a big sudden injury or from little micro injuries over years and years of use. And the nucleus shifts position. It follows those micro tears. That water kind of leaks out, and the disc starts to get lower and shorter. And with that nucleus, that center point being off center, it's easy for that vertebra on top to just sink into a different position. That's how we get these misalignments. It's my job to realign them, and that movement, that getting it back on top, helping that nucleus find that center point again, gives the body a chance to heal those annular fibers with things in the correct places. And that is how we can help discs stop degenerating and sometimes even reverse some of that degeneration. So if you're interested in more about how that works, stay tuned. I'm going to make more videos about things like this, including just regular generic back pain. But thanks for tuning in. Hope you learned something.